Aloha. I'm Doug Adrian Mejia, Assistant Professor of Pharmacy Practice at the University of Hawaii at Hilo College of Pharmacy, and I'm also Clinical Pharmacist in the Intensive Care Unit at Hilo Medical Center, and I'd like to welcome you to component number 3, Motivational Interviewing in Healthcare and Efficacy Evidence. As part of our learning objectives for today are to ascertain about the history of motivational interviewing, its creator, and its fundamental principles, learn how motivational interviewing can improve patient adherence outcomes, discover various settings in which motivational interviewing has been implemented and studied, learn about the studies in which motivational interviewing has been used to improve outcomes in diabetic patients. Motivational interviewing is an evidence-based clinical approach with a wide range of benefits, from patients to clinicians and healthcare organizations. As we're in the process of reform, a goal, in addition to everything else, should be a co-production, if you will, of activated, informed, engaged, and motivation patients and citizens. That being said, MI can be employed as an approach as healthcare systems, again, are in the process of reform to increase level of patient-centered care, increase participatory shared decision-making processes, and improve clinician-patient relationships. Ultimately, the clinical, public, healthcare, and financial benefits by applying motivational interviewing in our healthcare system may be dramatic. A little background about motivational interviewing was an innovative style of communication that was developed by Bill Miller based on observations of provider-patient interactions, designed for assisting patients to commit to change, a systematic clinical method of styling and counseling. Important idea to remember in healthcare is the change, in this case, can be adherence. Determining a patient's readiness to engage in a target behavior, as will be discussed in other modules, there are different stages of change ranging from relapse to maintenance. So we apply specific verbal skills and strategies, respect our patient's autonomy to facilitate a patient's decision making. So what are the benefits of MI in healthcare? Well, to increase treatment adherence by stimulating the patient's intrinsic motivation to change, again by addressing and resolving ambivalence and resistance. To train healthcare providers in exploring a patient's understanding and concerns, we determine a patient's readiness for change as the fundamental principle of motivational interviewing to reduce patient ambivalence to change. Ambivalence affects the patient's motivation and readiness to alter behavior. And again, the behavior in this case, in this context, is going to be adherence not only to medications, but to just general treatment modalities, whether they're pharmaco-based or non-pharmaco-based. The concept that behavior change is a shared endeavor is rather unique to motivational interviewing. That behavior change is not the sole responsibility of the patient, but patients do know what is best for them. The role of the clinician is to collaborate with our patients to determine a behavioral change strategy that will work best, enhance patient motivation to change or contribute to resistance, ultimately to respect and maintain a patient's freedom of choice. The clinical applications of motivational interviewing in healthcare have been applied to a number of areas of behavioral change. As it started, it is best known for its applications in the area of substance abuse. Motivational interviewing is a promising intervention to encourage health behavior change in a variety of disease states ranging from diet and exercise, substance abuse, diabetes, HIV medication adherence, oral care, and smoking cessation. As I've stated previously, it is a promising intervention for encouraging positive health behavior in medical and dental settings. I do want to step aside and talk a little bit about the oral health outcomes with motivational interviewing. As of early 2009, there were about 4 studies published. The obvious goal of motivational interviewing strategies in the dental setting is to prevent dental problems. But in addition to that, improving oral health status preserving oral health of infants and children through interactions and interventions targeting parents, and to delay or avoid timely dental care is also an area in which motivational interviewing is thought to help address dental oral health outcomes. It has been found to be more effective than no treatment or no counseling, obviously more effective than other active treatments or other forms of counseling, and may also be more cost effective than other treatments or other forms of counseling. I did want to talk a little bit about the effectiveness and efficacy of motivational interviewing in healthcare, as there have been several studies conducted within the last decade examining motivational interviewing and effectiveness in healthcare. Studies and reviews of MI have been published in the literature since its inception in 1983, but the studies have increased dramatically in number, whereas we only really had a handful of studies between 1997 and 1998 to over 20 studies between 2006 and 2008. Diet, exercise, diabetes, and oral health are again areas representing the growing empirical research examining the effectiveness of motivational interviewing. In particular, motivational interviewing in diabetes appears to contribute to the overall success of diabetic care in a few different areas, one of which is increased self-efficacy, which is a study or an article published in 2003 where motivational solution-focused intervention improves hemoglobin A1C in adolescents with type 1 diabetes. In this study, improvement in hemoglobin A1C in adolescents by 1.5%. This is a non-randomized controlled trial divided into two groups, those ages between 10 and 13 and 14 and 17. Again, this trial was conducted in the United States and shows the success that motivational interviewing can have with our young population. The next example, increased sense of control over diabetes, a study published, I believe, in 2009. The effects of group motivation interviewing and externalizing conversations for adolescents with type 1 diabetes. Treatment group in this article felt less threatened and had more feelings of control and acceptance, ultimately feeling less restricted by their diabetes on their lifestyle. The following example assisted patients to control glucose levels. This was a randomized controlled trial that was actually conducted in the United Kingdom. Effective method of facilitating behavioral change in teenagers with type 1 diabetes with subsequent improvement in their glycemic control. A couple other examples that I want to point out in which motivational interviewing appears to contribute to the overall success of diabetes care is increased physical activity and decreased weight. This was actually a study that found motivational interviewing to be a beneficial adjunct to obesity in women with type 2 diabetes, randomized controlled trial where the result was increased weight loss, enhanced adherence to behavioral weight control programs. Also, increased engagement in dietary change. This was a study conducted in the Netherlands which used dietitians, randomized controlled trial. In the treatment group, one thing that was very, very important to consider as we're going around this motivational interviewing module is that the counselors let the patients talk for the majority of the consultation. In closing, motivational interviewing, intervention to encourage health behavior change in a variety of healthcare settings and disease states. Pharmacists can motivate patients to resolve ambivalence and take positive actions. Pharmacists can gain experience with motivational interviewing by applying principles to selected patients with specific diseases. Mahalo, and I'll see you again in the future.